Hello, this is Doktor Yaman. We will talk about analysis of donor area in hair transplantation. Donor capacity and quality are very important in the success of hair transplantation. We evaluated the majority of our patients' donor area photos before they come to our clinic. However, the analysis made in the clinic is much more important. During the year, there are some periods that we visit some countries for consultation days. You can follow this date in our YouTube or other social media accounts. Hair transplantation method can be performed by any patient who has sufficient donor area. Almost all clinics even use DHA technique perform follicular unit extraction and take out micro units one by one. Currently, there are some clinics still using the method of cutting and removing the area of hair, which is much bigger, and then they separating it into small pieces. It's mean food technique. A strong and healthy donor area is very important. All food technique, and DHA hair transplantation technique. Before hair transplant procedure, the donor area is examined with the micro camera. We see the donor area capacity in detail here. Yes, our patient has high rate of multiple grafts. There are double and triple graft. Multiple graft rate is very important to create density on the recipient area. There are a lot of double graft, triple graft. Also, there are some single graft on donor area. In order to create a natural looking after hair transplantation, single graft should be implanted on frontal hairline. So we need single grafts. Our patient has sufficient density and graft on the lateral temporal zone and occipital zone. It's very important to evaluate the skin structure of our patient. That's why we also evaluate skin tip. Here I can say that our patient has no problem with his skin. Skin problems are very important in hair transplantation. If the patient has a skin problem, it may be necessary to start some treatments before or after hair transplantation process. The skin is very clear and good. During examination, you can see some marks of previous skin problems such as dermatitis and folliculitis, and you can see if the follicles is healthy or strong enough when we analyze donor area. It's important how hair roots look under the skin and how the skin holds the hair roots tightly. Yeah, it's very important to hair quality and healthy. Here, the hair follicles appear clear and healthy under the skin. In order to compare with the weak hair follicles, let's show a hair example here. You can see it's very clearly the area color change around hair follicle, color change around the hair follicle, and the skin doesn't hold the hair tightly. There are some discoloration around the hair follicle causes the skin doesn't hold the hair root tightly, and the fat acid produced, and there are some discoloration around the hair follicle causes the skin doesn't hold the hair roots tightly, and the fatty acid produced in the vein come up and causes color change. In addition, we can observe the appearance of the hair follicle under the skin. Look please. Not looking under the skin. In Fouet hair transplantation, the measurement of the donor capacity is very important, especially for limited areas. In fact, hair transplantation is a distribution process. Removing some of graft from the donor area, we transplanted them into recipient area. Then the hair quality and the number of hair in the donor area became very important. It can be measured how many hair follicle can be extracted from lateral temporal and occipital region. The number of grafts per square centimeter, 2 or 3 region can be counted, and then the number of the graft or hair in the donor area can be determined. The counts in this patient, he had 28 grafts and 62 hairs per 1 inch. With this detail, we can reach the total number of hair with a few simple calculation. There are advanced 3D systems for this process, but very close result can be obtained manually. It's also important to know the hair thickness for a good hair transplant result after Fouet hair transplantation. Hair taken from three different areas can be measured with the help of micrometers, and average hair thickness can be reached. Hair thickness can vary between 3 and 7 microns. Of course, we see also value above or behind them. In addition, advanced system can be used for this measurement. I have been doing hair transplantation since 2009, and I like the old methods more, so that I can see the skin and hair follicles easily. In order to create a successful result and sufficient density in Fouet hair transplantation, the number of grafts in the recipient area per centimeter square should be determined according to the hair thickness and rate of the multiple grafts. If the patient has thin hair and the rate of multiple roots is low, it should be increase the number of grafts per square centimeter in recipient area. For the result after the hair transplantation, it must be evaluated patient's skin well and taken precaution for a successful result. For a successful result after Fouet hair transplantation, it must be evaluated patient's skin well and taken precautions for the skin problem that may occur. We have another patient to show you as a second analysis example. It's possible to have another hair transplant operation if a patient underwent a surgery with Fouet or foot technique. As you can see here, the donor was deleted due to the first operation. When we examine the donor area with a micro camera, we can see the gaps in the areas where hair follicles are extracted. In such cases, the donor should be evaluated more detailed. In order not to leave bed or patch look behind, the number of hair follicles which will be extracted and the areas with hair density should be determined well. It should not be re-extracted from the place where many grafts were taken in the first operation. In this case, the beard area can be used as a donor. Beard hair is usually single and thick. It should be implanted with grafts taken from the donor area on the vertex and mid-scalp, but not frontal area, for a natural look. It's possible it should be mixed one beard grafts and with two donor area grafts. Implant clinic is one which has an experienced doctor who makes a good analysis. The doctor participates in the operation and who follow his patients. Finally, the best hair transplant clinic is the one which has an experienced doctor who makes a good analysis. The doctor participates in the operation and who follows his patients.